Mahipaul, a member of the Public Accounts Committee, in an OLO press statement asserted that the government, since its ascension to office, has allegedly been on a spending spree. Mahipaul gives a typical example.
With reference to the Ministry of Health, it was found that an amount totaling $1.915 billion was paid for drugs and medical supplies but not delivered.
According to Mahipaul, out of the $1.915 billion, only $9.294 million were covered by bank guarantees. Should there be a supply default in medical supplies for drugs, the Health Ministry would be in shambles in any attempt to recover the difference of $1.915 billion allocation, the PAC member explained. In relation to the awarding of contracts to conduct remedial works in Region 9, Mahipaul rebuked the Regional Democratic Council for awarding contracts to contractors who allegedly have questionable reputations.
C awarded 8 contracts totaling $106.830 million to a contractor who is currently blacklisted up to the year 2030 by the Public Procurement Commission of Guyana.
Mahipaul noted that the government's alleged misspending of monies from the Natural Resources Fund is without transparency and accountability and is in breach of the Fiscal Management and Accountability Act of 2003. Based on audits for the year 2022, prior to the submission of the Auditor General's reports, the APNU+AFC Member of Parliament noted that 5 government agencies did not return $623.404 million to the consolidated fund.
Up to the time of audit and at the time of finalizing the Auditor General's report in September of 2022, 5 ministries and 4 regions still had checks on hand, which should have been refunded to the consolidated fund.
Mahipaul is of the firm belief that the government's continuous breach of Guyana's financial laws and lack of accountability paints the picture of corruption. Antonio Dey reporting for the HCP Nightly News.